Okay, aloha kākou. My name is Nāʻālehu Anthony. I'm the director of COVID PAL. This is our second town hall, and we're so excited tonight to have these individuals with us. This is an exciting time. We've just gotten our first set of vaccines this week, and the bulk of the conversation tonight is going to be about vaccines and the process and what we need to do. And so, we're incredibly privileged to have these three folks with us who are going to help us walk through this process over the next coming weeks and coming months in looking at how we can keep not only our healthcare staff and individuals, but everyone, our loved ones and our community safe as we find our way out of this incredibly difficult pandemic. So first and foremost, I'd like to introduce Dr. Jill Green, President and CEO of Queen's Health Systems. Jill, thank you so much for coming on tonight, spending some time with us. Second, Dr. Mark Mugiishi, President and CEO of HMSA. Mark, thank you for coming out tonight. And then also we have Brooks Baehr, who's part of the communications department over the Department of Health. Brooks, thank you so much for coming out. And we're going to get right into the questions tonight. And the first one, Brooks, is for you. And the question is this vaccine safe to take?
Well, first of all, Nāʻālehu, thank you to you for this opportunity. Thank you to COVID PAL. Thank you to everyone who's so interested in this topic that they're taking the time to watch tonight, because this is just, this is so important to all of us. So thanks to all of you. What a great opportunity to be with Mark, to be with Jill, to be talking about this. Two people who know so very much about it, and I hope I can contribute just a little bit, because I think they'll start tonight. But let me answer your question, which is the vaccine safe to take? Well, we, the Department of Health, we think it's safe to take. And look, don't take my word for it, right? The U.S. Food and Drug Administration, they took a good long look at it, a rigorous review, and they gave it that emergency use authorization. And then the CDC's Immunization Committee, they took a look at it and they endorsed it. And then the Western State Scientific Safety Group took a look at it and they've endorsed it. And it didn't stop there, because most recently, a group here in the islands, the Medical Advisory Working Group in Hawaii, took a look at this Pfizer vaccine. And we're talking only right now about the Pfizer vaccine. And they endorsed it as well. So you've got a whole lot of really sharp people who've taken a good long look at the trials that took place, the efficacy, they've weighed it with the risks, and they've decided that it's safe to administer. And remember, these people are first and foremost concerned with our health and safety. So, if you put some trust in them and you believe in some of their expertise, you think it's safe. Now, I got to stress, and we'll probably talk about this more. This is a personal decision, right? That everyone's got to make. Everyone's going to have the opportunity to make that decision. This isn't being forced upon anyone. So everyone should educate themselves and listen to the experts and seek out as much information as they can. We've got a couple physicians here. Who do you trust more than your doctor, right? So talk to your doctor about this. Seek information. Do your own work. I'm certainly not a doctor, right? But I've done some research and I've decided, you know what? I'm going to take the vaccine. And why am I going to do it? And I hope this is why a lot of people will do it. Yeah, sure, I want to protect myself. I want to protect the people I care about. I want to protect my family. I want to protect my friends. I want to protect my neighbors, my community. I want to protect Hawaii. And I want to be part of the healing that gets us back to where we want to be, that gets us back to normal. So I'm not the scientist, but I've done some looking around. For me personally, I've made my personal decision, and everyone out there needs to make their personal choice.
Thanks so much, Brooks, for that statement. Dr. Green, we just had this amazing set of news in the last couple of days. Can you maybe just inform us as to where we are with the vaccine and the pizza box that you're calling it, and what's gone on since yesterday?
So it's a glorious day. In the hospital, we see up close and personal the pain and suffering this devastating disease can cause. And yesterday was the first day that it actually brought tears to my eyes, because we can see with great hope that if we all work together, there could be an end to this. Now, the pizza box is what we affectionately call it. That was how they transported this very important vaccine. And it has to be kept at ultra cold, minus 70 degrees. So there's a very specific protocol that has to happen. And you've been watching the news, you saw the planes take off Sunday night. Ours came in on Monday morning, and we got it at Queens Medical Center at 7:30. So quickly got it into the minus 70-degree fridge. And then over the last 24 hours, we brought it out, did the appropriate preparation. And today we had 5 volunteers, wonderful clinicians and caregivers at the bedside who were the first to be able to be immunized. And again, for me, tears in my eyes. It means that we can protect our nurses, our physicians, our environmental service technicians, that they may not have to worry about their families getting sick from the disease, and that we as a community, if we do this well, if we all are vaccinated and we're into the summer, we could be in a very safe environment as opposed to battling the disease today.
Thank you so much, Jill, for that. I'm going to pivot a little bit. Mark, I wonder if you can speak to some of the timeline that we're talking about with this vaccine. There's a lot of excitement. People are talking about it. This is global news. But we're getting some questions in. Ingrid was asking, when will Kupuna be able to be vaccinated? And she's also asked about whether or not there's some supply chain issues or what that timeline might look like. So, what does the timeline look like, and who is in line first for the vaccine?
Yeah, so, the Department of Health is, in the state of Hawaii, is in charge of picking the timeline. And they are following the recommendations of the federal agencies like the immunization protocol programs, AHIP, that decides how vaccines should be prioritized. And basically the first priority, what they call Tier 1A, is give it first to frontline healthcare workers and also to residents of skilled nursing facilities. People who are very vulnerable and have to live in a congregate setting, right? They're living all together. So those people will get it first. The first few shipments that we will get to Hawaii will really not be able to get many more people than that group. And remember that this vaccine has to be given twice and the second vaccine comes around 21 to 28 days later, or the second injection. So you kind of have to go through 2 cycles of that before you're going to get out of that tier. So, Brooks's Department of Health is really, kind of spearheading this, and they're doing a great job of making sure that they have the right partners to get it out there, whether it's Queens or whether it's other private partners that will go out and actually deliver these into the skilled nursing homes. But I wanted to just go back to the safety one, because to me, it's really cool the way this first vaccine works. That should give people, besides all the data that Brooks referred to, that obviously says this is safe because we have a lot of evidence. Just the mechanism of action, the way the vaccine works, should make you feel very confident and very, because I think what most people are afraid of is, oh my God, they're going to inject the virus into me. I'm going to get the disease from getting the thing, right? So why would I do that? Well, unlike other vaccines, this does not actually inject the virus. This one injects messenger RNA, which causes your muscle cells where it gets injected to actually make little proteins that fool your immune system to thinking it's the virus. And then your immune system learns how to attack that. So when you do get exposed to the virus, you can fight it. So when you think of it, not only is that incredibly cool, but it's also very safe because nothing really foreign and dangerous is being injected into your body. So I just wanted to add that to the conversation.
Yeah, thank you so much. Pivoting on that, there's a number of questions that have come in. And just for the Facebook audience, just so you know, over the last couple of weeks, we've asked multiple times through social media, as well as asking people to come in on the website, info@covidpal.org, to submit questions. And so we've called a number of questions tonight, but also we have a couple of staff looking at the Facebook feed right now and pulling questions in. And so, Jill, this question is for you. This has actually come in a couple of different ways from both Lynn as well as Cece. And the basic question is, if I'm older and I've previously had serious allergic reaction to medication, but I want to take the COVID-19 vaccine. What other options might there be for me on the horizon?
It's a really good question, and it's one where I would highly encourage you to talk to your personal physician or nurse practitioner. We do have, if you have allergies where you've had severe reactions, there are some cautions. So I think those are unique to the individual. I would definitely talk to my physician before I had it. And with that, I feel confident in how we're managing it. As we're giving the vaccine, we have very talented nurses that have all of the support and all the equipment and medications that you'd need if you had a reaction. But there is a caution that if you have severe allergic reactions, and think of it as if you're carrying around an epinephrine pen, then you should talk to your provider before you decide to take the vaccine. And Mark, your thoughts related to that?
No, I think you said it exactly right. I think it's a highly individualized thing. It's very interesting. This is just, it's not here nor there, but it's just kind of interesting, is that based on the same data, the UK, for example, is saying you probably shouldn't get it if you've had a severe allergic reaction. And the US FDA says, yeah, no problem. Just talk to your doctor. And if your doctor says it's okay, it's fine to get it. So you can look at the same information. And the reason for the difference is that in the clinical trials, there were a few people who did get a severe allergic reaction to this vaccine, but it's unknown if they got it from one of the specific ingredients in the vaccine, or if it has to do with the fact that they're just generally allergic to a lot of things. So I think your advice was exactly spot on. Unless you are definitely allergic to one of the actual ingredients of this vaccine, you should just talk to your doctor if you're worried, and you can get reassured with the help of your primary care doctor.
So I want to follow up on that, Mark, and ask you, since you gave such a great description of what this first Pfizer vaccine does, can you speak to what the next vaccine that looks like is going to get FDA emergency approval right around the corner, what that vaccine does? And is there a difference between the two?
Yeah, so the next vaccine, the one made by Moderna, is also mRNA vaccine. So it works in very, very similar ways. One of the main differences between the two that I know makes, providers like Dr. Green and her entire hospital excited about it is that it doesn't have to be at minus 70 degrees. It still has to be kept cold, but not that cold. So it's a little easier to handle, and logistically, it'll be easier to administer, especially if you have to go to remote rural places or neighbor islands like we have to go to, where you have to fly a lot and everything. It's just a lot easier if you don't have to keep something at minus 70 degrees. So I think we're all excited about that. There are other viruses in development. You've probably read about them. They're called, one of them is called the Oxford vaccine. The other one is being made by Johnson & Johnson. These are more traditional vaccines like the flu vaccine we take. And what they do is very kind of interesting, is nobody wanted to actually inject the SARS-CoV-2 virus, which is the one that causes COVID-19, into people. So they took a regular common cold virus, and they fiddled with its genetics so that it would have proteins on it that looked kind of like a SARS-CoV-2 virus without actually being one. And so when you inject that in, it can't give you COVID-19, but it causes your body to develop an immune response to anything that looks like COVID-19. So those are kind of cool. They're a little bit further away, and they're kind of on the horizon to coming out.
And all of them except, and correct me if I'm wrong, Mark, but all of them are two shots, except for the Johnson & Johnson, which is one shot, which might be appealing to, obviously, to some people. So they each have some characteristics that might make one more appealing than the other. But the two that we're talking about right now, the Pfizer, which Jill already has at Queens, and the Moderna, should it get approval, we're waiting for the approval, we're hoping it gets approval, they have a very similar efficacy rate, up around 94-95%, which is extraordinary.
Fantastic.
So I heard a piece of data in one of the meetings that I was in today, in terms of the analogy of how big of a lift this is, of how big of a logistical commitment this is to both state and county level, as well as all the healthcare providers, as well as all the way down the road to figure out how to do this. And the analogy that I heard was we've given about 750,000 tests for COVID thus far in Hawaii. And we all know what kind of lines we saw and just what kind of effort that was to test that many people. And if we're talking about a COVID vaccine that requires 2 shots, then we take our 1.4 million population in Hawaii and we multiply it by 2 to get 2.8 million shots that have to be administered. That's basically 4 times the size of what we've seen thus far to just administer COVID-19 tests. And so I'd like to open it up, and I'll start with Brooks. Maybe you can speak to some of the timeline of what that might be, but I'd like to hear from the 3 of you as to how big of a challenge this is, how long it's going to take, and how do we tackle it in a way that is orderly and makes sense as we go.
Well, Nāʻālehu, very intelligent people like Mark and Jill tell me that we're going to need 60, 70% vaccination across the population, across the adult population, if we're going to achieve herd immunity. And so right now, the Pfizer vaccine is approved in the United States for people 16 and older. So, 1.4 million across Hawaii, we can take the kids out of the equation, at least for now. But you're talking about sometime this summer, certainly upwards, we would like to have administered upwards of 1 million vaccines, right, to achieve herd immunity. 1.2, 1.4, 5, we're going to have to see. But you're talking about a lot of vaccines. So you used the term, a big lift. It is a huge lift. This has never been done before on this scale and this quick, right? So the logistics involved are just amazing. I mean, imagine, thank goodness we have such great partners at the hospitals who last week stepped up and said, hey, we're your hospitals. We have people here who know how to do this. We have these ultra cold freezers. So you know what we'll do? We'll not only take care of the people in our hospitals, but we're going to administer these vaccinations to people in our community health organizations. So if there's a clinic in the community, say over on the windward side that is near Castle, that clinic, their staff will probably be handled through Castle. And so that's just a huge thing. The Healthcare Association of Hawaii and the hospitals, they really stepped up and are assisting us there. The Hawaii National Guard is going to do a lot for us. They've already done a tremendous amount for us in contact tracing and other things, but they're going to help us in this vaccine rollout, right? Even just things like traffic control. I mean, it seems simple, right? But it is so essential. All these things are essential for this working well. The counties are stepping up, helping us. Everybody is coming to the plate. And it's going to be up to individuals to come to the plate, educate themselves, decide how to do it, participate in the process. But it is a huge, huge lift. And yeah, since it's never been done, there are going to be bumps along the road. There are going to be things we're going to have to adjust to. So Department of Health and all our other partners, we're all going to have to be nimble. We're going to have to be flexible. We're going to have to adjust on the fly. And we're going to need a little bit of patience out of the public, right? Because a lot of people are clamoring to get the vaccine already. And it's coming, folks. It really is coming. I'm prepared to do this one. Like Jill got the vaccine today, right? And they vaccinated some people. And Jill, I know you're going to do more this week. So the way I like to think of it is it's light at the edge of the tunnel. It's still a long tunnel. I see light, and it's so exciting.
Thank you, Brooks. Jill,
yeah,
how long is this going to take?
It is the light at the end of the tunnel. There's no question that it is a heavy lift. And one of the things that I have been so impressed with as a community, we're all going to need to lean in. Clearly, all of the healthcare providers are participating. We're already, as everyone else, is looking at their clinics and what kind of distributions that we can create. We also know, since it's a new vaccine, we want to make sure we're monitoring you very carefully. So for us, we'll be scheduling 20 with our caregivers now. We're scheduling a 20-minute visit. So you get the injection and then we monitor you to make sure you're safe. So it will take time. Right now, we are working hard to make sure those who are in frontline positions, trying to make sure they take care of you, that they're vaccinated, and that our fire, police, our kapuna, as Mark described, as Dr. Mugiishi had described, we want to make sure that the most vulnerable or the folks that are taking care of you have it very rapidly. But I anticipate that it'll take 2 months, mainly because of those 2 shots. You have your shot, and then it's going to be 3 to 4 weeks after when you get it. We also absolutely are going to be dependent on the number of doses that come into our community. So we're watching that carefully, and we really appreciate the Department of Health. They have been coordinating this extraordinarily well. But no, as quickly as we get through that first 2 waves, then we will be putting together clinics and distributions across all of our islands. We know that this needs to happen close to home, and we're all going to be part of it.
Yeah, hey, can I just add something to that, Nāʻālehu? And at the risk of first, this vaccine thing is a big deal, so we should all be so excited and so grateful. But it is a little bit of a wet blanket statement to say it's going to take us a while to get everybody vaccinated to herd immunity, like Brooks talked about, and maybe summertime before we actually get to that critical number. So that, summertime is 6 months away. And so I'm going to use an analogy from my old coaching days where I was a coach in this community. And, you're winning for 3 quarters because you've played a great game. And that's what we've done up to now. We've managed to live with this virus and keep it from devastating us since March, better than anybody in the country. We've just done a fantastic job with our behaviors of wearing our masks, avoiding gatherings. We've made all these sacrifices to win this game for 3 quarters. So don't stop playing defense in the last quarter. Let's win the game, right? So if we're going to get to the summer and be immune and be done with this thing, you can't get sick in the meantime. So let's continue those behaviors, knowing it's going to take a while. Continue the behaviors that got us this far, and then we'll be great as a community.
That's a great comment, Mark, and we're going to get to some more of that at the last half of the show, talking about what are some of the behaviors that we need to practice and just really kind of seeing that last quarter through. So thank you for that. I just got a question in that we were actually talking about right before the show started. So this is for Jill, and the question is from Matthew. And Matthew says, deep freezing is required for storage and transport. Do all islands have the capability to store vaccines at below 70 degrees?
Matthew, that's a great question. And it is a challenge. There's no question that we're having to work together because there are not a large number of those minus 70 degree freezers. In fact, if you think about the Big Island, Hawaii Island, Hilo Medical Center has one. We are moving one from Queens to the north side of the island. There are other smaller islands that don't, and there is another process that is appropriate, which requires dry ice. So you can move the box, you can move your pizza box, but it has to keep it at a very specific temperature, and you have to have the dry ice. We do have some islands that don't have dry ice. So we're working together. We anticipate one of the islands is Molokai. So we are anticipating that we're taking Learjets and taking clinicians with the dose to fly them to the island to immediately administer the doses. So we're going to figure it out. One of the things I know about our community is we are creative. We will get it done. And we're going to assure that we get the vaccines to all of our state.
Yeah, and people are talking about that. There has been a lot of publicity about the ultra cold storage, the 70 below, but don't think that, these two professionals haven't been thinking about it. Dr. Char, Libby Char here, our director at the Department of Health, has been spearheading that. They've been talking about it for a long time. They are planning for this. We have a memorandum of agreement with the company that produces dry ice here to provide us with dry ice as needed. And something that these two can talk about if they'd like to chime in about the handling of the Pfizer vaccine. It comes in a specially made box that is at the right temperature, and it can stay in that box for up to 5 days. And then once it is taken out, we can recharge it with dry ice 4 times. So we can actually recharge it several times with dry ice every 5 days. Fortunately, across the street from me here at Queens, they're able to throw it in one of their ultra-cold freezers. But if you don't have a freezer, as long as you have a supply of dry ice, you can recharge that box. And one of the nice things is, if we get this Moderna vaccine, which we're all hoping, all fingers crossed that baby comes through, that doesn't require that same unique and difficult handling procedure. So it's all part of that heavy lift. It's all part of the planning.
Yeah, thank you so much for that, Brooks. I have a question for Mark, and it really speaks to one of the things that we were talking about at the first town hall, and the fact that many kids aren't in school and they're at home and they're on Zoom day in and day out, and so this is about this other really important subset of the population, which are Keiki. And the question is, will our schools be safe if Keiki are not widely vaccinated?
That's a challenging question. I would say that generally speaking, the data that's coming out from across the country, as we look at schools, especially for schools that are 8th grade and younger, so middle school and below, middle school, elementary school, they've been effectively very, very safe across the country. I mean, you obviously want to do your best. We all know what it's like to have a class full of 3rd graders or 2nd graders. The concept that they will socially distance the entire time is, it's unrealistic to expect that. But nevertheless, somehow is becoming more and more obvious that there aren't lots and lots and lots of transmissions taking place amongst the very young. Now, there's always anecdotes, right? People are going to say, oh, but there was this one kid that got sick, and oh, there was this, one kid that got very ill and had to be hospitalized. And all of those things are true. And obviously those are tragedies when they happen. But as a general statistical fact, it is true that children under the age of 12, say, are not transmitters, and they don't get sick, as in statistical. So I think we will, as we feel safer with our own community, how much infection there is in the community, when that number is low, when we've all kind of perfected our own social distancing practices, when we started to vaccinate part of the population, so some people are immune, we're going to feel safer and safer of more widely opening schools, especially the younger ones. And when I say that, that does not include universities, by the way. That's a different story. So, Jill, I don't know if you have anything to add to that.
No, I agree with that. And I agree also with individuals that are over 16. And generally it's because of gatherings. As we are adolescents, young adults, the more we gather without our masks and don't physical distance, the more transmission happens, and particularly from people that are asymptomatic. They may not even know they have the disease. So I absolutely agree with your assessment, Keiki. And the schools are working extraordinarily hard. There's no question that they've been taking the safety practices very seriously. And where we're finding groups that take the safety practice seriously, we see an incredibly low rate of transmission. So it's really in our hands to make sure that we make it through. And I really appreciated you earlier saying, I think that we're going to be in our masks and working through this issue to the middle of the summer potentially. So we got to be vigilant.
So there's a handful of questions that have come in all along the same lines, and so I'm going to bundle them up. And the question is, will this vaccine be available at like a Longs or Walgreens, or how will regular people be getting this vaccine?
Brooks, do you want to start?
Well, I can give it a shot. Okay, so let's start where we are now, right? The vaccine's on the ground. It's so exciting, right? But guess what? It's not available to me yet, but it's coming. So I've got tremendous hope, and I can be patient. The people who should get it first are going to get it first. The healthcare workers. Thank goodness we can finally protect the people who've been sacrificing so much to take care of us and our families, right? So that's just fabulous. And then the long-term care population, it's been hit so hard, so tragically impacted by COVID. And so the fact that we're going to be able to offer them another layer of protection, that's wonderful. So there are kind of priorities, right? And we're gonna tackle them one at a time. And as we work our way down the priority list, and as the vaccine becomes more and more available, eventually, yes, sometime spring, summer, the hope is that you will be able to go to your local pharmacy and get vaccinated. Because our goal here is to make this as readily available to everyone as possible in a safe, secure manner. That's obviously tremendously important. But we want to make it readily available. We want to make it easy because we want people, if they choose to take the vaccine, we want them to go ahead and do it. So that, there's this whole hierarchy of who deserves it the most or who needs it the most, and we don't just kind of throw a dart at a dartboard and make those decisions. There's a whole way to do that. It kind of risk assessments, and number one thing, the first thing we ask is who is at risk of becoming infected, becoming one of the numbers you see on that daily COVID case count. Number two is who is at risk of severe illness and perhaps death if they are not vaccinated. Number three is who's at risk and the highest risk of spreading it to others. That's one of the four factors. And the fourth one is what's the risk to society if we don't vaccinate somebody? In other words, if Dr. Mugiishi gets ill, how does that impact things? All of a sudden now his patients don't have a doctor to go to. So, if there's an infection at one of the utility companies, we don't want them to stop functioning. They're critical to us. So those four things, risk factors are weighed in there, and that's how we determine who's going to get what. And right now we're at the level where, given the number of vaccines, the vaccine right now, today, is only available to healthcare workers. Next week, we think that we're going to be having the vaccine available in long-term care facilities. And then after that, we just keep going down to essential workers, and we work down that list. And as the tens of thousands of doses of the vaccine roll in, hopefully you go to your pharmacy, you go to your family physician, you go to a clinic. We hope to be setting up sites actually where like the testing sites where you will sign up in advance and you will come in. You will have a scheduled visit. You're supposed to be there at 12:15 in the afternoon. You come in. You've pre-filled out something. You come in. You give them your name, your information. Here you go. Here's your vaccine. There's your vaccine card, and we'll see you in either 21 or 28 days for your second dose. So we want to make it as easy as possible. And as this develops, there'll be more and more opportunities to get the vaccine in more and more places.
This is an important time to plug both websites, Hawaii COVID-19 as well as COVID PAL, to help get the word out as to how this is going to take place. This is a very dynamic process. Everything shifts day by day, and we want to make sure that we have the ability to get you the best information possible from the folks who are making the decisions as to kind of what happens next. I want to take a second. There's one last question that's come in before we pivot to the second half of our show, which is really speaking to the economy and a little bit of supporting local, but also how we can get through our safe holidays. And this question goes to Jill, and the question is from Aaron, and it says, can a person showing signs consistent with the COVID-19 infection receive the vaccine, or must they first test negative?
Again, this is one I talk with my doctor, but my preference is that you get the test, you get the COVID test. You want to know that. Anytime you have the signs and symptoms, don't hesitate, get the test. When we look at the positivity rates, the rates that you do have COVID are low, but get tested. And then if you were COVID positive, then you need to talk to your physician. So I'd start with that to make sure that you're healthy, and then I'd proceed from that perspective. Dr. Mugiishi, what would you do?
No, I agree with you 100% for sure. Make sure you treat your acute infection, whatever it is, right? Whether it's COVID-19 or the flu or whatever, you want to get well from that and make sure your immune system is ready for taking the vaccine. It does raise an interesting question. If you had COVID-19 before, should you get the vaccine? Because theoretically, you might be immune already, right? Because you had it before. So I think as science stands today, the answer would be yes, because no one has definitive proof at what antibody level in your body or what degree of protection you have from a previous infection. So it would be wise to get the vaccine, because we do know that vaccine provides you 90 to 95% protection. We don't know if your exposure previously did. Now that may change over time. We may learn more and we may find out, yeah, if you had it and you have an antibody level, a certain amount, you don't need it. But we don't have that information now. So the safer thing would be when it's your turn, which might be soon if you're in one of those, high categories, or it might be later when you're, like the rest of us and the normal thing, then when it's your turn, you should get it.
Okay, thanks so much for that. We're about halfway through the show, and I wanted to take some time to address some of the things that we're talking about, which is this idea that we have to still make it through the holiday season. We have been extremely, extremely fortunate to not have seen rising cases like we have in the rest of the mainland. If you go to some of the maps that are tracking COVID-19 cases, the rest of the U.S. is either deep red or bright red, and we're still at the yellow phase, which is incredibly hopeful. But we still have at least two different holidays stacked next to each other that we have to still remain vigilant, and we still have to push forward as a community to keep COVID curbed as long as possible. So we're going to switch gears and switch into some of the questions that have come in and around that. And this is really speaking to this idea that the economy is critical for us to move forward. Just as, the vaccine coming online will affect our economy, hopefully in positive ways, but we also can make choices with what we're doing with the limited resources we do have available. And so what we did was we actually asked a couple of our friends to pose one of the questions tonight, and they're good friends of ours. They were hosting the Pop-Up Makeke this last Sunday, and so they have this question for Dr. Green, and I'd like to play the tape now.
How's it, everybody? I'm Billy V.
And I'm Paula Akana, and welcome to the set of Pop-Up Makeke.
We're glad that you're here. It's been a really unique time having the chance to tell everybody to shop local, support local, buy local during this critical and unusual time in our island's history, in our planet's history as we go through COVID-19.
Important part is not only are you helping local businesses, but you're able to do it safely. Shopping safely from the comfort of your home.
So we're going to ask you a question right now. And Dr. Green, thank you so much. We're going to address this one to you. How else can we socially distance and still enjoy the holiday season?
So Dr. Green, that question is to you. How can we stay socially distanced and still enjoy our holiday season?
Great question from Billy and Paula. So it is critically important. We've said that for all of us to keep safe and to protect ourselves and protect our ohanas, this is the most critical time. I don't know about you, but every night I look at the news, and yesterday they were saying 5,000 people an hour were getting the disease. We know how to manage this. First, we still need to wear our masks, and we need to keep our distance. Now that's really difficult for us during the times where we want to gather as large groups, we want to be with our ohana, we want to demonstrate our love and compassion. Right now is the most important time. If we do this, we're likely to be able to get through this without an additional surge and save thousands of lives in our community. So please, as you did over Thanksgiving, keep your family bubble very small. Do not go to gatherings. Please try to have people less than 5 people together and ones that you know have been with you for a long period of time. That means, and I've got wonderful family members, my sweet son and daughter-in-law are in Seattle. They always spend the holiday with us. Not this year. For their safety, for my son's safety, we're going to be virtual. We are figuring all sorts of ways that we're celebrating. We're going to be watching the same movies together. We're going to be playing some games virtually, listening to music, doing a variety of things in a virtual way that ensures that we're still connected, but does not put anyone at risk. It's the time where it's going to take some constraint to do that, but we do know that if we do it, we'll be safe. If you choose to be with your family member and keep your distances as much as possible, please wear your mask. Please wear your masks the majority of the time. If you're eating, make sure you're physically distanced. And if you can be outside, we live in a beautiful environment. If you can be outside and be 6 feet apart, that's better. And if you're having a meal, bring your own food so that you're not having multiple people touch the food. So it's different. But if you do decide to get together, make sure you wear your masks. Be outside if you can. Keep your time short. And I'm really advising us, and I'm living it, we're going to be doing a lot virtually. And we did it over Thanksgiving, and we had some wonderful conversations and very fun times. So there are ways, and there are many others. CDC has some sites, and I know COVID PAL has a list of great activities that you can do as well.
Thank you so
Mark,
much.
what are you doing with your family? And Brooks, what are you doing with your family?
Mark? No, a lot of the same. You know, like obviously it's not the same as it was before. You find alternate ways to make sure you can still pick the best things in life and make sure you can enjoy them. You know, outdoors is a wonderful thing. We're so lucky we live in Hawaii. It's probably one of the reasons why we've done so well here is because people can find a lot of fulfillment, you know, enjoyment outside, stay healthy and still keep their mental health in a good place. You know, it's not always true in the mainland, right? The cold weather drives everybody indoors to each other. They gather, and then it's all over the place. So we're lucky, and you know, and we're doing good things with our blessings because, as you referred to a couple of times, we're now almost 3 weeks from Thanksgiving, and everybody was terrified of the surge we would have because of Thanksgiving. You're seeing that on the mainland. We aren't seeing it here, and that shows that you know, there might have been anecdotal things where I saw like 10 cars at that one house. They must have been gathering. Okay, so that might have happened, but in aggregate, right? I think we behaved well, and we should pat ourselves on the back and say we could do that. We did it well. We protected everybody, and we just need to do it again for Christmas and New Year's. And I think we'll be in great shape.
Brooks, you got anything?
Well, I'd echo everything they say. You know, Jill asked, what about our families? My sister was going to come out here. I have my 90-year-old mother living next door. My sister has canceled now 3 trips. She was going to come out for the holidays, but after reevaluating what's going on and the ugly situation on the mainland, she wisely has canceled her trip and rescheduled for September. So we're hoping that, you know, let's hope that the world is in a much better place by September. And in talking about the holidays with Dr. Char, she does want to remind people that if at all possible, keep your holiday celebrations to your household unit, you know, the folks who are already in your bubble. And if you're going to expand it beyond that, do all the things that Jill and Mark talked about, you know, take it outside, wear a mask, social distance, no hugs and kisses. You know, it's difficult, but you know, we want to spread cheer and not COVID during the holiday season.
Yeah, well said. You know, I have a specific couple of questions, you folks. The first one is for Mark. You know, we have any number of traditions, as do, you know, many cultures that point to New Year's as this time of renewal, and this idea that you know, there are these functions that go along with those traditions that not only require us to come together, but require us to do certain traditional things, you know, next to each other, It's been pointed out, whether it's making an imu or pounding mochi or these different things. You know, in your opinion, like, what of these things are safe when we're in that kind of close quarters?
Yeah, so it's not actually the activity that would be dangerous or not dangerous. It would be whether or not you can do it with you know, the safe protocols we talked about, where you can wear a mask, where you can make sure you're social distance, where you're not really in close contact and gathering with a whole bunch of people. I think any of those things that you discussed, they're doable, right? And you just have to spend time thinking through how you're going to make sure that you don't, you know, you don't create situations where people are becoming what's called a close contact, where you're interacting with somebody without a mask really close for a long period of time. That's not good. And so, you know, if you can think of clever ways to do that, especially if it's outside, like, again, the activities you talked about, you know, all the more power to you.
There was a question that came up actually just the other day in a conversation, and I'm going to toss it up to Brooks here. And you know, there's also any number of gifts that get made, whether they're cookies or candies or chocolates, that people personally make, and they become gifts that go out to their friends and their family. And so, you know, Brooks, any thoughts on whether or not those are not only safe to make, but also safe to accept as gifts and then eat?
I was going to reach right over here. And so someone here on our communications team brought me this, and I have been told by some very smart people here who spend their life studying these kind of things that it's okay. All right. But you see what I have right here is I have my hand sanitizer, right? So if I'm going to touch the bag, maybe I'm going to do my little hand sanitizing afterward. Hey, Dr. Char brought me some homemade chocolate chip cookies the other day, and her mother dropped off some cupcakes. I didn't get one. She dropped off some cupcakes the other day, and so it can be done, but you know, don't linger. Exchange the food, and then step back. Keep your mask on. The baked goods are fine. The packaging's good. Just, you know, always wash the hands, sanitize the hands, practice the social distancing. I know we get tired of hearing it, but these are the tools that can really get us home on this thing.
I'm going to follow up with that, actually, Brooks, and I want to ask a question. You know, the Department of Health is starting to release these reports on where the clusters are, and is just digging down into more and more data so we can be more selective as to how it is that we move forward and you know, slice up the really problematic parts of where we're seeing clusters. And so there was a question that came in that says, you know, what's the relative risk of shopping in person at malls or craft fairs or farmers markets compared to the grocery store or doctor's offices?
Yeah, and it's the same thing, right? And I'd love to hear from Jill on this one, but it's the same thing, right? We all go to the supermarket, and thank goodness they put those little things on the floor where we, you know, they tell us where to stand, but we're all wearing our masks. People in Hawaii have been so good at this. And if we can just be patient for a little while longer, let's keep doing these things. But shopping, hey, if you can do it online, support local online, fantastic. You know, don't not give gifts. We do want you to support local, but do it online. Keep your distance if you go out. Try to avoid those really busy shopping times. Like, do it early.
Yeah, I'll just add, you know, similar to your question about whether you should be pounding mochi or building an imu. Same thing with shopping and everything. You know, it's less about the activity and more about whether you can manage the distance, keep your mask on, you know, not have a close contact with someone, not gather in like a large group, all of those things. And those are quite doable in malls and shopping centers and grocery stores and things like that. So the relative risk is safe if you are safe.
Completely concur. And one of the best things, so if you're wearing your mask, you're watching your distance, anytime you're uncomfortable, if you get in an environment where you feel it is too crowded, then you leave. I found particularly shops have been extraordinarily safe using the safety practices. I look at them very much like healthcare providers, where they are rigorous about washing hands, making sure you have distance, and creating an environment where you feel comfortable while you're purchasing. And I've been doing that consistently and have felt very, very safe.
So I'm going to pivot, and Jill, I'm going to come back to you with this question. And you know, within the holiday season, in many states, it's cold, it's shorter days, people are indoors, we're indoors more now, and that can already have an emotional toll on people with the isolation from COVID. Specifically, what can we do for loved ones who are hurting emotionally during this isolated time in this holiday season?
There is a lot of pain and suffering, and one of the worst is the feeling of depression, anxiety, and isolation. There's no question. So it's very important that we keep in contact, that particularly if you're distance, that you are using your phone and FaceTiming, that you're getting together on Zoom calls, that you're touching bases on an ongoing basis. In all of our communities, there's also support. And many of us are reluctant to reach out to say, hey, we need some help in terms of talking through this and figuring out what will help us stay well emotionally and spiritually as well as physically. The health department has resources, your health providers has resources, many times your employer has resources. So please don't hesitate. I think it's very healthy if you're starting to feel, it's very normal to feel depressed. Talk with your family members, talk with the people you trust, talk with your health professional, and reach out to many of our programs that can provide additional counseling and support. All of us need it. And we'll all get through this together. You do not have to suffer alone. So do reach out, keep connected, and definitely get some help. And it can be offered virtually in most cases.
Thank you for that, Jill.
Yeah, no, that's a great point about the virtual support for behavioral health. I think that's really important. One of the sad things about this pandemic is there's a lot of data now coming out that says if you had COVID-19, you're way more likely to have mental illness. If you took care of somebody with COVID-19, healthcare workers, you're more likely to have mental illness. And if you just live during this time when we have COVID-19, you're more likely to have mental illness. That's a really bad trifecta. You know, it's like basically everybody's at risk. And so you should not feel alone. If you're not feeling good, you should reach out for help. It's common. A lot of people have it. And one of the best ways to start, besides your primary care doc or people you trust, is virtually on telehealth. Almost all the telehealth platforms have really good resources where you can speak to a therapist online, and they can be a tremendous help.
Yeah, thank you for that. I know HMSA has a long list of resources that are available. We have some of those resources available on the COVID PAL website as well on the resources tab. So that those resources are available for people. Mark, I want to follow up with a question about a healthy lifestyle or some of the choices that people make and how that may or may not affect them with respect to COVID-19. And so there was a question that came in from Pamela, and I'm gonna kind of try to synthesize the question together. But you know, do we see, or is there data on how bad COVID-19 is for people who, for instance, you know, drink alcohol or smoke, or do we see people who are who have a better chance of surviving COVID-19 if they're you know, healthier and they're eating fruits and vegetables and they're hydrating?
I heard a couple of different kind of questions in that one question. So I'll start with the first one. Has COVID-19 kind of affected everybody's health and wellness in terms of like how they eat, how they take care of themselves, things like that? And I think the answer is yes, partially because of the anxiety and depression and everything else it's caused, the isolation. It makes us all, you know, feel less well. And sometimes that impacts the way we take care of ourselves. So you may exercise less, you may snack more, you may do things like that. And so in order to combat that, you need to make a conscious effort. And again, we're lucky here in Hawaii in that we live in a place where you can go outside and enjoy the outdoors or do something that makes you feel better in a safe way, in a safe place. So I think just, conscious effort to do that. Take care of yourself. Remember, that's an important thing. Your second question is whether or not healthier people have a better chance of withstanding COVID if they get it. And the answer is unequivocally yes. People with chronic diseases, and especially if their chronic disease is more out of control, they will do more poorly, and they will end up with Jill in her hospital, and Jill will have to take care of them. And I think Jill can speak to kind of the balance of, obviously there's some very healthy people who come into the hospital, but there's such a minority compared to those who have other kind of underlying conditions. And so, yes, taking better care of yourself also helps you fight COVID-19.
Couldn't have said it better, Dr. Mugiishi. When we look at the individuals that are hospitalized, out of all the individuals that get COVID, it's first, if we look at the number of people and the age groups of those who get COVID, it actually is well distributed between some younger people and some older people. The ones that get hospitalized differentially tend to be those who have chronic conditions, who are more frail, and who have health issues coming into it. So there's no question that the death rate is higher if you have multiple chronic conditions, your health is already poor. We do everything we can, and we're getting very good at the protocols, and we will give you the best care possible. But it is health, as you can take care of yourself, it will help, and it's very important. Many people have chronic diseases. It's very important to make sure you're wearing your mask. Make sure you're having your physical distancing. Preventing the transmission of the disease to you is essential. I have family members with chronic diseases. They are very closed in their bubbles because even with their masks, we want to minimize the potential that they could get the disease.
So one last thing I forgot to mention, Nāʻālehu, is one of the things that has come out of this pandemic is that a lot more people do remote work. And they get stuck in Zoom hell, where you're sitting in front of a screen all day long, looking at the same iPad or computer screen or everything. Don't forget to get up and walk around, right? It's not good for your health to just be sitting in a chair for 10 hours looking at a screen. So let's, keep reminding yourself, I gotta move. I gotta, even if it's just regular movement, that's exercise.
Yeah, thank you for that. And speaking of, our hour is almost up, and I personally know that at least half of this group has been seated in their chairs in their offices for many, many hours, and so I do want to be respectful of your time. We just have a couple more questions that I want to try to tackle quickly. The first one is from Yumi, and she's basically saying, if you're pregnant, can we take the vaccine? Dr. Jill.
Right now, that is not, we are not advising that. Again, you need to talk to your health professional, but we are not under 16, individuals that are pregnant, or individuals who have major allergic responses are the three categories that we are not advising at this point.
And then, Mark, the question for you really quickly is, okay, we're all going to take the vaccine. It's 2021. Do we still have to wear our mask? And if so, if yes, why?
Well, yes. I mean, I think until the disease is eradicated, which we won't actually know until we know, it can still be transmitted. And so you should still protect yourself and wear your mask and social distance. So yes.
Okay. I want to give just a couple minutes, maybe a minute each to each of you, just to, summarize, anything else that you think people should know about either vaccines or safe holidays as we venture into just being a week out from Christmas and another week to New Year's. So Joe, I'll let you go first. What do you have to say to folks?
This is an amazing time. We can control this disease. As we get vaccinated, it will significantly help us. Right now, we can control it by wearing our masks and keeping our distance, all those safety practices. It doesn't reduce the love and aloha, and we can have a holiday. And I can tell you from the bottom of my heart, I can see us doing this together, and we can prevent what's happening across the country.
Dr. Mark.
Yeah, no, couldn't have said it better. I'm just going to reiterate my sports analogy and say we've been winning this game all the way. Like, let's not blow it at the end, right? Play defense all the way to the end of the game, and let's just make sure we come out of this a winner.
Thank you for that. Brooks.
Mark instituting the full court press as we close the
There
show.
you go.
Yeah, that's why he won all those state championships, I tell you, coaching high school basketball. Folks, hang in there. Hang in there. We've done so good for so long, and now we have more promise than ever. We have another tool in our tool chest, with this vaccine. So hang in there. I think most everyone is doing a great job. People like Dr. Jill and Dr. Mark and the hospitals and the Healthcare Association and Hawaii National Guard, we're going to get there. The governor has done everything he can do to save lives and protect people. And keep logging on to COVID POW. You're going to find great information there and good stories from people who've been impacted by COVID. And you might also want to go here to HawaiiCovid19.com. This is a Department of Health website. You go here right now and you're going to find information on vaccines, which is very important. You're going to find information on safe travels. You're going to find a guide to safe holidays, which we've talked about, and also how to gather safely. So HawaiiCovid19.com, COVID POW, loads of good information out there. It'll keep you busy while you wait for your turn to get that vaccine. We're going to do this, Hawaii.
Geez, Brooks, you could run for office with cue cards like that. I just want to say thank you to Brooks and Mark and Jill for making the time for us tonight on behalf of the whole COVID POW team. We're just really excited to be able to bring our public and our community and our loved ones and our family just the best information that we can. We will be doing a third town hall sometime after the new year, probably talking about the economy and updating on vaccines. Stay tuned. Just like Brooks said, he stole my line, covidpow.org, hawaiicovid19.com. We want to make sure that we can get everybody the best information possible. That's why we're up late. People are still in their offices trying to get the word out. And so with that, mahalo nui a oko, pakahi a pau, and good night. Aloha.